Hello, 204 class. How are you? Guess what? You get to do some clinical lab time anyway. So we're going to create some clinical lab videos according to the weeks on your outline. And this is kind of what they're going to look like. We're going to go through all the skills for you. And that way, when we get back together to do checkoffs, you'll have been with us the entire time and know exactly what to do. Before you come to class, you'll know to review the videos. And today, of course, we're going to talk about diabetes management. So first of all, let's go through a little bit of A and P and see if you can remember what vascular system vessels, the 5 vessels that I'm going to want you to tell me. Let's see if you can remember those. So we'll get a red, we'll get a blue, and we got a purple here. So if I'm coming from the heart, remember, from the heart, I've got this big giant vessel that comes up back from the back of the heart and distributes blood to the body and then comes back down behind the heart and down through the abdomen, and then of course takes off with all of these arteries to all structures in the body, right? Right. So we have, these are arteries, and arteries go away from the heart. Okay. So arteries, let's take this one and let's go and make it into a hand. This artery is going to go down into this hand. When it gets to the end of the fingers here in this hand and throughout other places in the arm, the artery is big, it gets smaller. As it gets smaller, it's called an arteriole, right? We're just remembering the names right now. And then when it gets to the very end, and it's going to turn around and come back, it's no longer an artery, is it? It's a vein. But before it's a vein, it is what? Capillary. It's capillary, so it's kind of purpley. So capillaries, if you remember, are just one cell thick. They're kind of tiny, and therefore you get this one little red blood cell that can go through it at one time. So you just have this one red blood cell at a time that can go through a capillary. As far as diabetes goes, when you get high glucose measures in your vascular system, it destroys these little capillaries because they're so thin, they're one cell thick, that they can't handle the acidic value of all that glucose. And so it destroys these capillaries. And what happens when you destroy capillaries? You're no longer feeding nerves. You're no longer feeding structures. And so the tissues can't heal. The nerves are kind of going off because they don't have the supply they need. And so you get that neuropathy that comes with it. So we didn't finish this. Arteriole, capillaries, and then venules, and then veins. It's a terrible drawing, but it'll have to do. So I just want you to remember, and the veins go back into the heart, of course. But it's that little tiny capillary system that's throughout your body. Wherever you have a large vessel that goes down into a smaller vessel, all exchange in your entire body takes place at the capillary level. All your gases, all your nutrients, everything, all medications, all waste, all of it takes place, all fluids, all of it takes place across the capillaries because they're leaky. They let things in and out. Okay, so now we're reviewed on the vascular system. Let's talk a little bit about the pancreas. So the pancreas, sorry, this is going to be a horrible drawing, but it's all right. So the pancreas is located kind of behind the fundus of the stomach. And it kind of looks, so head, neck, body, No arms, there's no armies here. So it's going to kind of start over here, and then it's going to come up here. It kind of looks like a feather, the way the outside of it is. It's kind of curly on the outside. And if you remember, the pancreas, it also connects to the bile duct, the common bile duct. There's a spleen right here, the hepatic portal system, so the liver, the gallbladder, the pancreas, the spleen, they're all kind of connected in there because they work together to do many things. One of them, of course, is digestion. And whenever we have high fats, then of course the gallbladder is going to put bile in there. And whenever we intake high carbohydrate meals, that turns to sugar. And so then the pancreas acts, and the pancreas acts with insulin. So insulin is what the beta cells in the pancreas will use to produce and distribute insulin with whatever carb count that you have. So with diabetes, in America, diabetes is the #1 disease that's growing. And diabetes type 2, of course. And when you're producing, or when you're intaking, when you intake too much carbs, too many carbs, too much sugar, then of course your pancreas is put to work over and over and over and over, and it gets a little tired. We become a little insulin resistant. It can't produce as much as we're taking in. And so glucose levels start to go up after a while, and then people's A1C goes up, and then we become diabetic or pre-diabetic. So it has to do with the function of the pancreas and the intake of your carb levels. So diabetes type 2 is kind of what we're talking about today. Diabetes type 1, let's go over that a little bit, is when the beta cells in the pancreas die. And usually this happens during youth. It can happen up to age 30, and they no longer function. And so diabetes type 1, those who, the way people mostly find out is from diabetic ketoacidosis. So their loved one will go into that the DKA, that diabetic ketoacidosis, and they'll have that fruity breath. Their brain sometimes doesn't work well. Sometimes they can go into a coma, and they go, of course, when they get them to the hospital, they can take those blood samples and do the lab work and find out right away that this is the issue. A blood sugar reading for DKA can be between 600 and 1200 or more. And immediately they will start giving them insulin, which will bring them out of, they have to do it with a drip, and they have to do it slowly, because when you have a high content of sugar in your blood, it's also in your brain, and you can't change the chemistry of your brain quickly, because that can cause some really big issues and can cause coma and death. So they would do a slow insulin drip and bring them around slowly so that the brain chemistry can change at the same rate that the body chemistry changes. Then there's, that's for diabetes type 1, and it's called juvenile diabetes. And again, the pancreas, the beta cells in the pancreas don't work at all. They die, and they are not replaced, and they don't come back alive, and they cannot reproduce. And so this is a condition that used to be when people would reach the age of 30, they knew that was pretty much the end of their life. But with good diabetes management nowadays, with insulin pumps and good nutrition, people can live an entire lifetime with diabetes type 1. And we're going to focus on, again, diabetes type 2. The other part of the pancreas is the alpha cells. And the alpha cells produce glucagon. And that is something that the liver demands. Glucagon is, what it does is it builds up your glycogen stores, your sugar in your muscles and your liver, in case your body needs an increase in sugar level. So if you've ever not eaten lunch, not eaten breakfast, and all of a sudden you're feeling kind of that tunnel vision and you just feel kind of faint, and you sit down for a few minutes and you still don't have any food to eat, but after a while, all of a sudden you feel better and you don't know why, it's because your liver has let the alpha cells in your liver have coordinated to release this glycogen from your muscles and again your liver stores so that it increases your blood sugar, so to the point where you can level out again and make better decisions and get something to eat. So with diabetes patients, our DM2 patients, we sometimes will find them and their blood sugars are too low, say 30 or in the 20s, and they're not responsive. So we wouldn't put anything in their mouth at that point, but we do have an injection called a glucagon injection. And we would give them this injection and it would immediately help their body release those glycogen stores that they have and increase their blood sugar level. And a lot of times you will see that patient wake up 5 minutes after that injection. And at that point, then you can start giving them, once they're awake and their level of consciousness is enough that they're clear, then you can give them things by mouth until 911 gets there. Because of course, this is going to be a 911 call. So again, alpha cells produce glucagon. Glucagon is also what we give diabetes type 2 patients when their blood sugars get way too low and we can't give them anything by mouth. So alpha cells, glucagon, beta cells, insulin. All right, let's talk a little bit about the signs and symptoms of high and low blood sugar. Sometimes people can't tell when their blood sugar is high, especially if this is something that's normal for them. I had an insulin, a dialysis patient, had a dialysis patient. And when she would come in, we would always take her blood sugar, of course. And her blood sugar would always be between 400 and 600. And when you put somebody on dialysis, dialysis takes their blood sugar down. It pulls the sugar from their blood and it levels it out at 100. But I would notice that when her blood sugar would get down to about 200 or 250, she would start sweating. She would start shaking. She would feel like she had to throw up. She felt like she was going to die. She would curl up in a little ball. Her clothes were soaked. The blanket she was sitting on was soaked. And this is when her blood sugar got down to about 200, 250. And so then we had to give her glucose tabs to keep her awake and keep her conscious. And we had to feed her puddings or jellos or juices while she was on dialysis to keep her from passing out due to low blood sugar levels. And that was because she was used to having high blood sugar levels. She unfortunately lost her toes, her feet, her hands were gangrenous, but they couldn't cut any of the fingers off. Her fingers were all black and curled backwards and sideways because she didn't take care of herself. She used to drink 32 ounce pops, sugared pops a day, and not take her insulin, not take her blood sugar. So she didn't take care of herself and she died before she was 40. So education is huge. I did help to educate her and her husband a couple of years before she died. She did stop drinking pop. She was eating better, but it was too late. She had gone blind. And her kidneys had completely quit working, even though she had 25% when she started dialysis. So the signs and symptoms that you're going to see when you have patients who have a low blood sugar are going to be, you're going to hear them talk about that tunnel vision. They can be dizzy, sweaty, diaphoretic. They can even start breathing quickly because they don't know what's going on, decreased level of consciousness, all the way to passing out. So syncopal episodes. Another thing, they might look like they're inebriated. So it's going to be, let me show you the picture I've got here of the pancreas, just so you can see what a real picture of the pancreas looks like. Isn't that cool? So you can see here's your pancreas, and the stomach would cover right here. Here's your spleen, and these are your kidneys. So you can see all of these organs are right together. Here's the common bile duct. So this is going to run down to the gallbladder, and your liver will cover this portion of these organs here. So pretty cool, huh? Kind of looks like a feather. Here's the tail, there's the head, and look, it even has a neck. All right, we're going to take a break for just a minute, and then we will come back.